Seniors, you've been struck by vertigo or dizziness and you can't get into vestibular therapy or an ENT for 2 to 3 months. What are you going to do? It can be debilitating to have vertigo at any age, but specifically for seniors, you're at an increased risk for fall. You may live alone and not be able to function or have anyone to care for you. So what are you going to do? Today, I'm going to give you 5 tips that you can start to managing your dizziness until you can get into in-person vestibular therapy or an ENT doctor to start to manage your symptoms. For those of you that don't know me, my name is Amy McMillan. I'm a mobile vestibular therapist in Northeast Ohio, and I'm here to give you tips and tricks on how to treat your dizziness at home. And if you haven't already, I'd really appreciate you hit that subscribe button so I know that you want me to continue making content like this. With that being said, let's get into our video and make sure that you stick around to the end because I have some bonus tips for you as well that you won't want to miss. So when you go to your doctor for vertigo, they're going to do 3 or 4 things. They're going to look in your ear and see if you have an infection. If the answer is no, they're going to say, I don't know what's wrong. You should probably go to the ENT or vestibular therapy. They're going to check your blood work and make sure that you don't have any anemia, vitamin deficiencies, thyroid issues, or electrolyte issues that could be contributing to your dizziness. They're going to look, hopefully do a urinalysis and look at your urine to make sure that you don't have a UTI, which is one of the most common causes of dizziness that I see in the elderly population is UTIs. That and confusion plus dizziness, I suspect a UTI. If they've checked all that, they're gonna say, wait it out, here's some Meclizine, go home. And that is just unacceptable. So here's what we're gonna do. All of these recommendations are vague because a specific diagnosis has a specific treatment plan. But all of these techniques should at least be safe for you to get started on managing your dizziness. First thing, I want you to limit your Meclizine. Normally it's prescribed as needed. If your Meclizine does help to reduce dizziness, okay, that is fabulous. In an acute stage, it will suppress that vestibular system and it can make you feel better, a little drowsy, but it can make you feel better. After you start to feel that dizziness subside, you want to use the Meclizine PRN as prescribed by the doctor, which means as needed. So if you're dizzy and it helps, you can use it. If you use it and it doesn't help your dizziness, try to limit your use of Meclizine. You can talk it over with your doctor. A lot of times Meclizine can have more harm than good when taking it long-term use. It suppresses that vestibular nerve, so it can actually prolong your healing, make you drowsy, interact with other medications, and make you a higher fall risk. So make sure you understand the pros and cons of using Meclizine as prescribed by the doctor. Step 2, I want you to use a cane or a walker. The last thing that we want to do is fall, hit our head, break a hip, do anything worse. If you are feeling unstable, use an assisted device. It doesn't mean that you have to use it forever. It just means that until we can get your symptoms to calm down and treated, we don't want to cause any other injuries. So go ahead and get a rolling walker or a rollator that you can sit down, or just a cane, a quad cane with 4 points, anything to increase your steadiness. The last thing I want you to do is walk around and furniture walk, because that furniture can move. You could slide your hand on the wall. It really is not the safest thing to use. Step 3, you are going to start increasing your hydration. Even if you don't have a UTI, you could be dehydrated. There's a lot of conditions, BPPV, migraine, kidney disease, and just plain dehydration that can make you feel lightheaded. If your blood pressure runs a little low and you don't have enough water in your system, that blood pressure can get even lower when you're up and moving around. And simply adding a teeny bit of salt to your diet and some water can help boost that blood pressure and make sure that you're not dehydrated, causing extra dizziness. So step 4, we are going to start to work those inner ears by getting active head motions. So in a seated position, I want you to shoot for 10 of these each way. So you're gonna look over your left shoulder. Your eyes are actually going with your head 10 times to the left. It should not be painful. You should feel steady in your seat, and then 10 times to the right. Now, if your dizziness is caused by BPPV or crystals, so if it's only positional, going left and right should be relatively safe and not cause you any symptoms. After that, we are gonna do tipping to the right. Again, this is relatively safe even if you do have BPPV or crystals out of place. Go slow and just get your head and inner ear used to moving again. We would do 10 to the left as well. After that, we're gonna do up and down. Now this is where it comes with a caveat. So if you look up, go to a comfortable range, come back down to middle, and then look down and come back down to middle. If you spin in either of those and it doesn't get better after 2 or 3 reps and just makes you feel nauseous, don't do that direction. So if it makes you feel like a 1 or 2 dizziness, I'm okay with that. But if you are nauseous and you're just spinning, skip that direction. Otherwise, do 10 slow reps in each up and down direction. The next exercise we're going to do for the inner ear is just to hold a pen or your thumb out in front of you, and you are going to start slowly to your tolerance, moving your head left and right, up to 60 seconds. If you can go a little faster and giving yourself just a touch of dizziness, again, 1 or 2 points, that is okay. You'll do that for a minute, and then you'll do up and down. So little baby up and downs, trying to increase your speed as able. Okay, so that's called VOR times 1, and we'll do that up to a minute. Last inner ear exercise you're going to do is look at an object far away. I'm going to look at the camera, and again, I start my left and rights, slower if you need to. The inner ear is not as active when we move slow, but if you're in acute stages of vertigo, you're gonna have to start slow and then work your way up to a little quicker as able. So you'll do 60 seconds left and right, and you'll do 60 seconds up and down, if you can tolerate it. If you can't, just do less time, and that is okay. So that is step 4 to start to get that head and inner ear working. You can do that at least 1 time a day, twice if you're feeling up to it. So the last step, step 5, we are going to start balance exercises. So find yourself a safe corner and a chair or walker in front of you, and we're gonna do some balance exercises. So right here, I'm in my corner. The balance exercises we're going to start with, I have my hands on the wall. I'm going to put my feet together if I can. And for 30 seconds with my eyes open, you're going to try to hold your balance there. If this is easy, after your 30 seconds, I want you to close your eyes. Again, make sure that there's a chair in front of you or you have your hands ready to catch yourself. Close your eyes and see if you can hold your balance. If you need, touch the wall, then take a hand away, take another hand away, and see if you can hold. If you lose your balance, just touch again. You're so close to the wall that you can fall into the wall if you need help. Don't stand out here and then have so much room to fall. Tuck yourself back into that corner for safety. So 30 seconds with eyes open, 30 seconds with eyes closed, and then if you can, I want you to start with those head turns, just 2 to 3 reps, left and right, 2 to 3 reps, up and down. So that little balance routine is gonna round out step 5. So those are my 5 steps on what you can do to manage your vertigo and dizziness until you can get in an in-person session with a vestibular therapist or ENT in your area. Some other tips that I have, my bonus tips, in the description and in comments below, I'm going to include my free dizziness tracker. So I want you to go ahead and claim that, grab that free copy. So when you are going into the doctor, you'll have a list, kind of an inventory, a journal of all the things that trigger your dizziness, and that's gonna help you get a proper diagnosis. And then the last tip that I have is to make sure that you're going to a certified, qualified vestibular therapist and not just somebody who happens to see balance patients in a clinic. So if you haven't heard of this website, I want you to go to VEDA, V-E-D-A, which is right back here. And that has a nationwide, I think maybe even worldwide, list of certified vestibular therapists. So all you do is go in the directory, type in your zip code, and they will have any vestibular therapist in your area that will pop up. So hopefully you enjoyed that video. If you have any questions, please leave them in the comments below. You know I love to communicate and respond to those questions. And until I see you next week, stay healthy, stay steady, and stay strong.